Over the course of the next few sessions, I'm going to talk a little bit about mindfulness and use some techniques that counselors can use in their practice to help their clients work on mindfulness in their daily lives. Mindfulness-based stress reduction is an empirically based strategy of counseling that has shown to have great results, actually. It's used primarily in DBT. Marsha Linehan was a really big fan, and it's also used in ACT to help individuals who are dealing with substance abuse disorders and addictions. It also benefits clients and therapists. It's important for therapists to take care of themselves, to be kind to themselves, and so mindfulness is a great way for therapists to reduce their own stress, especially job-related stress. What is mindfulness? Mindfulness is a psychological state of awareness, and it's also a practice that promotes that awareness. It's a moment-to-moment awareness, or a state of psychological freedom that occurs when your attention remains quiet and limber and without attachment to any particular point of view. As I said before, it is more of an awareness in the moment of what you're doing. And it's an awareness of your own experience without judging whether that's a good or bad experience. And it is a state, not necessarily a character trait. So when you're measuring mindfulness in an individual, that individual will always have some sort of a state of mindfulness. You can't fail at mindfulness, which is a good thing. Mindfulness is a systematically cultivated practice, and you apply it to your attention and your bodily sensations, also your emotions, your thoughts or cognitions, and your surrounding environment. So you use your 5 senses in order to focus very intently on what is happening in the present. You're not thinking about the past, you're not thinking about the future. You're just kind of living in present awareness of your environment and what's going on inside your mind. It stimulates the middle prefrontal part of your brain, and that's the part that's associated with self-observation and metacognition. So it strengthens that part, which is thinking about how you observe situations. It's thinking about thoughts. So it helps people to, especially people who maybe struggle with depression, maybe they ruminate a lot and they tend to judge their thoughts and think badly of their thoughts, which only exacerbates depression. This would be a technique that could help them to just observe their thoughts more as just an environmental phenomenon rather than something that they would internalize. There are 4 studied affective benefits to mindfulness. The first one is emotion regulation. Second one is decreased reactivity and an increased response flexibility. So people are better able to deal with stressful situations that may arise suddenly. There are also interpersonal benefits and intrapersonal benefits. So there are benefits within a person, and then there are benefits in the person's relationships as well. All right, so we're going to practice some mindfulness techniques today, if that's okay with you. What we're going to do first is just a real simple exercise for 1 minute. If you feel comfortable closing your eyes, that's a good thing to do. And you want to sit in your chair with your feet, on the floor, and your back kind of straight, but not too straight, relaxed. But you want to be paying attention at the same time. Okay, so we're going to close our eyes. Okay, and what I want you to do is just focus on your breathing. Just try to clear your mind of anything that's in there, and just focus on breathing in and breathing out. any thoughts that come into your mind, you can just note them, but then let them go and just go back to focusing on your breathing. We'll do that for. Okay, minute's up. You can open your eyes, relax. Good. How did that feel for you?
Good.
Yeah?
Yeah.
Was it hard for you to just focus on your breathing? Were there other thoughts that were coming into your mind? Or?
Yeah, I definitely had other thoughts.
Yeah.
And, you know,
But it felt relaxing to you?
it did.
Good. Okay. All right, so for this exercise in mindfulness, we're going to focus on both your inner experience and your outer experience. And we're going to go back and forth between the two. So your inner experience would be anything that you are thinking in your mind. It would be things like your breath or maybe tense muscles that you might notice. The outer experience is going to be like your five senses, like what you're hearing, what you might smell, things that are happening outside of your body. So for 1 minute, you'll focus on your inner experience, and then for the next minute, you'll switch and try to just focus on the outer experience, and then we'll talk about what that was like for you. Okay, sound good?
Mm-hmm.
Okay. All right, so let's put our feet down and close our eyes. And we'll start focusing on our inner experience. So your thoughts, your breath, anything that's tense in your body. Okay, a minute is up. And now we're going to switch our concentration to focusing on outer experiences. Things that we hear, smell, taste, feel on your skin. Whatever's happening outside of yourself. Okay, it's the end of 2 minutes. You can open your eyes. All right, how did that feel? What was that experience like for you?
It's very calming.
Mm-hmm.
You know, just being quiet.
Did you notice one particular focus was more difficult than the other? Was it more difficult to focus on inner or outer sensations, or was it
I think it was kind of equal.
kind of equal?
Yeah.
But it was very relaxing.
Mm-hmm.
All right, Joanna, we're gonna practice focusing on a single object.
Okay.
That's gonna be our exercise. One of the things that mindfulness helps is that feeling sometimes that we get of our thoughts wandering. So this helps to kind of train our minds to focus on a single thing for an extended period of time. So I have a couple objects here. You can choose any one that you would like. And what we'll do is for the first minute, I'll have you set it over there on the table, and we're just going to look at it. And then for the next minute, I'll ask you to actually pick it up and hold it. And you can, turn it around and kind of experience it with your senses that way. Okay? Does that sound good?
Mm-hmm.
All right. You can choose whichever one you want. And I will choose this one. All right. And you can just sit yours right there. Okay. Look at it. And I'll put mine here. And we'll start for a minute just looking at the object, noticing the color, the shape, anything that you see. Okay, 2 minutes are up. What did you think about your object? Do you know it really well right now?
I do.
Yeah.
I do. I've felt it. I've touched it. I've stared at it. I picked it because it reminded me of when I was in labor with my kids, and there was paintings on the wall in the hospital, and each one had either a picture or a tin or something, and I used this visualization I pictured my pain from the labor going into the pole, the tin, whatever, and then there was a hole in the bottom, and my pain went out the bottom.
Yes.
So that's what it reminded me of.
That's very much like mindfulness,
Mm-hmm.
is trying to train your mind to focus on one single thing. And a lot of times you can use mindfulness for pain reduction. So, how did you experience that exercise? Was it difficult? Was it relaxing?
No, I think it was relaxing as well. One, I'm tactile, so I like the smoothness.
So you like picking it up?
I liked picking it up, which is why I picked it, because I thought it would be nice to touch.
Yes.
And then I didn't have trouble looking at it, because as I stared at it, it brought back other memories of looking at it. So that was.
Are you ready to practice another mindfulness exercise? Okay. This one is called Band of Light. What we're going to do is, it's actually like a muscle relaxation thing. So let's sit first with our feet on the floor. We'll get comfortable. Okay, you're going to envision like kind of almost like a halo.
Okay.
Just kind of floating above you. And what we'll do is you're just going to envision it slowly kind of going, starting at your head and going all the way down to your toes. And as the halo passes each part of your body, you're just going to kind of check and see if there's any tension in that part of your body. And you're not going to do anything about it. You'll just notice it. That's all. And we'll do that for maybe a minute. Does that sound good? Okay. All right. Close your eyes. Envision your halo. And it'll start to go over your forehead. Down past your face. Are you finished, Julia? Okay, you can open your eyes. So what was that experience like? Was it relaxing?
It was relaxing. To sit still and just sort of be quiet isn't something that I do all that often.
No, really? I don't do it often, but I should do it more often. What did you notice about the sensations or any tension that you were feeling?
More tension in my shoulders and in my back, and then not as much below that.
Right.
Pretty much
So that's where you carry your stress. Good. So you did learn.
I did.
Yeah. In order to assess my client's level of mindfulness, I used a measurement instrument called the 5-Facet Mindfulness Questionnaire. And it was actually based on an analytic study of 5 independently developed mindfulness questionnaires. So the validity of this test is pretty good. It's a list of 39 items, and clients rate each item on a scale of 1 to 5, 1 being never or very rarely true, and 5 being very often or always true. And we could use this instrument to assess a client's progress after an 8-week to 10-week course of mindfulness treatments to see if their mindfulness is helping out with their stress reduction. Okay, so Joanna, you took the 5-Facet Mindfulness Questionnaire, which is a measure of your mindfulness. And again, mindfulness kind of just exists on a continuum. So you can't say that someone is completely not mindful. If you're alive, you're mindful. So you have your scores in front of you. Your overall mindfulness score is just going to indicate the average of what you were scoring on each of these individual areas. Do you have any questions about your overall score?
No.
No, okay. Your observed score, again, it's going to break your overall score down into these categories, is your perceptions, your sensations, your thoughts, your feelings. So it's how you observe yourself and the world around you. Your describe score is being able to describe or label in words your beliefs, opinions, emotions, and expectations. Acting with awareness, of course, is avoiding distractions and understanding what you're doing in the moment rather than going through emotions. Non-judgment is being, of course, non-judgmental of yourself and your own experience. And then the last one is non-reactivity, which is being able to perceive your emotions without reacting to them. So you're, instead of, being angry, you're saying, I feel angry.
So the higher the number would be indicative that you're able to do that, to separate, look at it from above, so to speak.
Exactly. That's a really good way to describe it.
mine being 2.6 then would be indicative that I'm not very good at getting above and looking down.
Right.
I'm right there in the thick of it.
It would indicate that that might be something you want to work on when
Okay.
you're practicing your mindfulness exercises. You might want to work on your non-reactivity, which would be, in the moment. It would be emotional regulation for you.
Okay.
So you're saying I feel angry, or your thought was angry rather than I am angry. Does that make sense?
Yes, it does.
Yeah.
It's
And
awesome.
that's something I think that women in general, we're more reactive than our male
Right.
counterparts. And so, that's something that we all tend to want to work on.
Right.
But I think overall your scores were really good, especially because you haven't taken any mindfulness courses or,
Right.
engaged in this sort of activity